Dr. Van Dien, the issues that you have in Cambodia are not comparable to those that affect France. The health system in your country, which is still a developing country, and it is really showing a lot of inequalities of access to treatment and medicine, particularly in big cities, and the copay that is up to 60%. So can you explain to us briefly the challenges that you're facing at the moment at the Ministry of Health of Cambodia, and tell us how you're intending at the horizon to 2030 to put in place a coverage, medical coverage that is universal, that you still don't have in your country.
For the floor and the opportunity to speak and to share about the Cambodian healthcare system. As you may know, that Cambodia developed the healthcare system since the scratch. After 1979, we have only less than 50 healthcare professionals survival from the Khmer Rouge killing field. Okay? Yes. So I just give a little bit that you can know. And over the past 2 decades, we have seen the incremental of the life expectancy to 74 years in 2024, up from the 12 years in 1979. And the significant reduction of the maternal mortality rate, infant mortality rate, child mortality rate, and neonatal mortality rate, it's really dramatically increased, as highlighted in the Cambodia Health Demographic Health Survey in 2022. And these improvements are linked to the better immunization as well as the expansion of the healthcare service delivery in Cambodia, including the implementation of the Health Equity Fund and also the National Social Security Fund. And the National Social Security Fund covers the health benefit for the people, and also giving the opportunity for the health services, including the maternity, benefit about 2.7 million people, costing about $574 million annually that the government paid. Okay? Yeah, paid. And quality improvement in the health services also include the community engagement and integrating the technology into the implementation of the primary health care booster implementation framework. That the acronym is the PHC-BIF. Okay? Yeah. So, in line with the royal government of Cambodia vision, we aim to achieve the universal health coverage by 2035. And this universal health coverage target 80% of the population covered by the social health protection, and 80% of the population receive the health services. It means that we expand the health services to cover the population about 80% by 2035. Last but not least is to reduce the out-of-pocket payment to 35% from 60% as estimated or reported in the WHO documentation. But we try to do this comparing to the total expenditure of the population. So we are in the crucial point in accelerating the implementation of the PHC-BIF, because there are two arms. One arm is the improving the health service delivery at the community level, and the other arm is about the encouraging the community participation, including the local community accountability and engagement, which before we have not done that so much yet. But now we are trying to do that. So our PHC-BIF aim for the healthcare improvement and quality, including the access to the rural population, meaning that we think about the people-centered, equitable, and also they integrated to tackle the risk of the non-communicable disease, which accounted for about 60% of the total deaths in Cambodia. Okay, yeah. So I think despite our progress, but the challenge remains. One is the urban-rural disparity, and that continues to impact the healthcare access. And about more than 64% of the total population living in the suburban area. So the access to the rural healthcare facility need the enhancement. And urban centers often have the advanced technology and better facility, while some rural areas lack the basic services, equipment, and trained professionals. Therefore, improving rural health infrastructure, basic equipment, and engaging community will help to bridge this gap. And many health centers in Cambodia meet the national standard. However, upgrade and renovation are still necessary and is underway right now. We are doing that. Learning from the COVID-19 pandemic, building resilient our healthcare system is also crucial, especially in the emergency, control and prevention of the infectious diseases, while expanding care and prevention for NCD. We are strengthening also the public health laboratory and enhancing inter-sectoral coordination, including One Health approach, to create a robust response framework. According to the WHO, as I mentioned earlier, that 60% of the health expenditure come out from the pocket, okay, out of the pocket payment. And Cambodia addressed this by using the scheme such as the Health Equity Fund and also the free exemption for the poor on the spot, mainly on the healthcare facility, that can help for the poor and vulnerable group. Over 3 million of the Cambodians benefit from this scheme. Another promising step is the expansion of the National Health Security Fund to cover both formal and informal workers, and the rollout of the cash transfer for the pregnant women, including the children under 2. And this is the key initiative that link the social protection and health in Cambodia. But broader integration and scalability remain our priority. Talking about the healthcare workforce, okay? We seen the increasing the number of our healthcare. Over 30,000 professionals from less than, as I said, 50 survival after liberation in 1979. And more than half of them work at the sub-national level, okay? And especially at the health center located in the community. And increasing number of the healthcare workers is essential for us right now. And the ratio in 2024 increased from 20 to 28.8 per 10,000 population. We invest in training, digital innovation, allowance incentive, and capacity development to support our healthcare workers in the remote area. Another point is the strengthening the referral system from the health center to the referral hospital, especially to reduce the challenge for the emergency care, as well as the delay of the maternity care, and especially with the northeast part of the countries. Digital tools enhance the quality of diagnosis access in remote area, while we learn by doing it with an inclusive and straightforward tool. So in conclusion, Cambodia is at a defining moment in its healthcare sector transformation. We are making a steady stride toward universal health coverage by promoting the primary healthcare booster implementation, reforming our healthcare financing, and building a resilient health system, including promoting equitable access for health for all. So thank you very much. Question regarding the substandard and falsified medicine. But before talking about that, I would like to talk about the how we can make our healthcare system more effective. Okay? So first, we must strengthen our primary health care. Sorry. As the foundation to reach the universal health coverage, ensuring the services are people-centered, accessible, and equitable, as I highlighted earlier. These include the investing in health workforce capacity, improving infrastructure, enhancing essential service delivery at the community level. Right now, we are focusing pretty much more on expanding the health services at the tertiary healthcare level, mainly at the community level. So we have like 1,305 health centers. So now we are improving, including health infrastructure services, expanding the services to cover the hypertension and also the diabetes patient before they have to come to the capital, to the provincial town or to the capital city in order to receive the medicine. But right now, they can access the medicine at the community level where it's near to the house. Okay? So that is one to promote the equitable access to healthcare in Cambodia. Second, the effective governance and accountability mechanism are crucial to optimize resource use and ensure quality. This is we strengthen also the accountability not only from the health structure but also the local community and community itself, including the health center management committee and the village health support group, that they are key in achieving bringing the people from the community to link with the health center. Number three, integrating the digital solution and robust health information system can improve efficiency and decision making. So that right now we are promoting and improving, even looking at introducing learning by doing some of selected digital tools that our primary healthcare facility, they can also adapt, learn by doing at the same time. Number four, it's a sustainable health financing. This is, we are implementing and expanding the coverage for the National Social Security Fund and also the Health Equity Fund, plus the fee exemption at the healthcare facility, which only the Health Equity Fund and National Social Security Fund cover up to now 7 million of the total population, comparing to total population of Cambodia, 17 million. We are right now still expanding, okay, work in progress, and hoping by 2035, we are able to reach, as I highlighted, 80% of the population receive that. Number five, strengthening the service delivery require integrated model, focusing on the preventive, promotive, palliative care, including the rehabilitative, and especially for the vulnerable and underserved population. One of the good lesson learned is right now we are working with the local community, try to search for the people who are unable to pay, but they sick, but they are not going to the health center. Then each village, they have to make sure that no one left behind. And now we are doing that. And hoping that by doing together with the local community, then we are able to really helping the vulnerable and the poor population as well. Finally, community engagement and health education is very essential we should not neglect about that. And it's kind of boosting the knowledge. I may say that the health literacy, boosting health literacy of our population, that they can shift their focus from the cure to prevention. That's why right now we are promoting the prevention rather than cure. People often, they said that I don't care about my sickness, I care about my business. If I get sick, I can have my doctor to cure me. If the doctor cannot cure me, it's the problem of the doctor, something like that. But right now we have to shift the way of thinking and promote their better understanding to buy the health prevention rather than treatment. Okay, so this is a more effective the way that we see. So inclusion, a more effective healthcare system built on equity, resilience, efficiency, sustainability principle, with leave no one behind. Talking, I have time, right? Talking about the substandard and falsified medicine, because of the time, we can talk about this subject for the whole day, because this is a complex issue, and we need the local, regional, and international collaboration in order to tackle this issue. And I would like to move step forward to the action that we are doing right now. One is the revised drug law and other related legal documents. Number two, promote online registration of drugs by improving the Cambodia pharmaceutical registration system and updating the registration procedure and required document. Improve and expand the inspection activity with law enforcement. Strengthen the regional coordination, especially with the bordering country. Build capacity in detecting, reporting, and response. This is very important. And enhance and promote regular conduct of post-marketing inspection. We are doing that a lot right now. Yeah. Share information is very important also. We can share among the region, among from country to country, that we can work together. Enhance quality control capacity in collaboration with WHO Collaborating Center. Last but not least, we have to raise the awareness among the public about the substandard and falsified medicine, that they can also report to the Ministry of Health through our hotline system 115, including working together with the custom and other regulatory authority, that we can control the border and as well as the substandard and falsified medicine. Thank you very much.
Thank you.